All right, let's just continue from where we just dropped out. We were talking about the clinical implications. All right. So when we are talking about the clinical implications, we are actually talking about the practical knowledge and the speciality in the daily life. All right. So when we are talking about the psychopharmacology, we are actually talking about the clinical implications regarding the psychiatrist, regarding the clinical psychologist, and mental health professionals as well. So basically, the role of medications in treating the psychopathology is as far as essential for providing the comprehensive and obviously the effective mental health care, right? So after talking about all these two topics, we can actually conclude that the role of psychopharmacology in treating the psychopathology is actually multifaceted, right? And as far as essential as like the psychotherapy. So, understanding the impact of medication on the mental health and its challenges and emerging trend is very important for us being a psychologist to understand as well. For implicating the new treatment plans and for improving and improvising the life of the individual with certain type of psychiatric disorders. Because when we are talking about recently, the practices include the personalized treatment plans, right? Holistic approach. And that approach actually just governs around the personalized treatments. So the personalized treatments will be more effective if you are able enough to understand what kind of medication a person is actually taking on daily basis. Do this kind of medication have certain kind of manifestation or the practical effectiveness on the behaviors or the cognition of a person? Even if a person is having a high blood pressure and he's taking that particular kind of medication, trust me, that particular type of medication have particular type of side effects which have certain type of cognitive as well as the behavioral impact on the health of the individual, right? So this is the reason we used to talk a lot about psychopharmacology when we are talking about the psychological treatments or the treatments for the psychological disturbances. All right. So our next part will include understanding the, yes, we have talked about all the diagnosis and behavioral manifestations. Now we will be talking about the psychopathology or the behavioral manifestations of the psychopathology. We have talked about psychopathology. We have talked about the psychopharmacology. We have talked about the diagnosis or the group of disorders we will be discussing in this certified course. But now we will be talking about, or we will be actually overviewing or talking about the framework of the psychopathology, which will be covered. As we have talked about the diagnostic criteria, we have talked about the impact of the behavioral disorders. We are able enough to understand that what is actually the professional insight for these complex behaviors or the manifestations of the problems in an individual's life in case of psychopathology, right? So by defining the psychopathology, it's actually mean understanding the nature of the psychopathology and its role in the mental health, right? You have to understand one thing that in case of any kind of psychopathology around the world, there is certain kind of disturbances as well as there are certain kinds of stimulus associated with that. All right. So exploring these various disorders and their impact on the individuals, we will be able enough to actually have a very comprehensive overview on the diagnostic categories of the psychopathology. So here comes the diagnostic criteria, which actually um, mean about the diagnostic criteria. Actually, it's an in-depth analysis of any disorder in case of any problem around the world. So in case of psychology, we have a particular manual, or you can say a standardized manual for diagnosing a patient or diagnosing a person with the psychopathology. For the case of clinical psychologist or any other mental health practitioner, it's a DSM-5 TR. But in case of obviously the psychiatrists, who have the capability to actually induce or prescribe a medication to a person, they have ICD. All right. So both of these manuals are standardized and they have particular guidelines to identify the mental health disorders. Here we will be discussing about the DSM-5, right? And its criteria, its behavioral manifestations of the problems, and possible treatment intervention for those bunch of disorders, specifically common and practical in our culture. All right. So here comes the behavioral manifestation. As we have talked earlier in the class, behavioral manifestation of any psychopathology is actually related to the symptoms and signs of the problem, right? So here we will be actually talking about the observable behaviors, understandable behaviors over the period of time, which are actually associated with that particular kind of problem or that particular type of psychopathology. All right. We have talked about the anxiety disorders, the disorders or the behaviors related to the anxiety disorders or the anxiety related psychopathology. We have already overviewed these disorders or the group of disorders. When we are talking about the anxiety disorders or the category of the disorders related to the anxiety, we are not only talking about the anxiety. We are talking about those particular group of disorders, those who involve anxiety-like state or anxiety itself. For example, obsessive compulsive disorder, right? For example, certain phobias, thanatophobia, obviously, right? There are certain patients who would come to you with the fear of darkness, right? So that also involves the anxiety. Then comes another group of disorder, that is the mood disorders. The analysis of the behavioral manifestations of any mood disorder is as much important as like the medication itself. It's very crucial for every psychologist to understand that basically the behavioral manifestation, or we normally used to give the ABC chart or like that, those are all basically the behavioral manifestations analysis. All right, the thought analysis or the continuum analysis of that particular patient. When you will be able enough to understand the impact of this mood disorders on the individual's well-being, you will be able enough to develop or emphasize the individualized treatment plan for that particular person, which will be far more effective than any kind of just rural kind of treatment. Then it comes to another group of disorder related to the psychotic episodes. When we are talking about, all right, wait a second. I just have a bunch of students to admit. All right, they're all done. So when we are talking about the psychotic disorders, as I have discussed earlier, that involves a bunch of disorders or the category of disorders, including schizophrenia, including the schizophreniform. That is basically the categorization over the period of time of the presentation of the behavioral manifestations of psychosis itself. All right. So when you will be able enough to examine the hallucinations, types of hallucinations and delusions, you will be able enough to actually understand the probable behavioral changes or the cognitive impairment in case of individual with psychotic disorder. Psychotic disorders are not only about schizophrenia. It's far more complex than that. So basically, we will be talking about those complexities in our later classes. Then there is another group of disorder we have talked earlier, why most probably this kind of disorder are not being able to be learned in this 1 month certified course. The reason is the complexity and the you can say the sensitivity of this topic. That is the personality disorder. Basically, what is personality? If we have to talk about the term personality, we can state that personality is actually the consistent patterns of trait in a person where a person responds relatively similar whenever the particular similar stimulus came into his life, right? Then, over the period of time, that consistent pattern of behavior becomes his personality, right? So, when that uh, particular bunch of behavior gets maladaptive, or you can say a dysfunctional, then those dysfunctional patterns of behavior, along with the cognition, actually develops a disorder. Those disorders are termed as personality disorder. All right. So, whenever we will be having a time to discuss about the personality disorder, we will be talking about the psychopathology related to the personality disorder. So here comes the eating disorder. This is actually the review of our today's class now. But hopefully you guys can join on time later in our next classes. All right. So eating disorder is actually related to the distorted eating habits. It can be minimal to the food intake, or the requirement of the food intake is far more less than your required amount in actual life. All right. Likewise, in anorexia, or a person is actually bullying in himself or herself to take particular food in a very short period of time, but rebulging that food as well. All right. So that becomes bulimia. Bully your body, right? So they include the eating disorders. And those continuum of eating disorder is very sensitive for any psychologist to identify and to understand the stimulus regarding these disorders. So we will be able enough to understand the psychological factors contributing to the eating disorders, or the basic behavioral manifestations related to the eating disorders lately. So here comes substance use disorder. As like the personality disorders, we will not be able enough to cover the substance related or the substance use disorders here, because it includes the addictive behaviors, your client's substance dependence habit. All right. So the reason why we are not able enough to actually discuss these two group of behaviors, or these two group of disorders, sorry, is because they are so far more complex to actually just discuss in 1 month class. They need a certified or an in detail training for any person to actually highlight this kind of problem in any kind of person. So that's the reason we will be discussing the neurodevelopmental disorders, ranging and autism spectrum disorder, obviously, intellectual disability, attention deficit hyperactivity disorder, as well as learning disabilities. Then we will be moving toward depression. We will be moving toward mood disorders, including the bipolar and depression as well. Then we will be having a class on psychotic disorders. After that, we will be moving toward our next plans of treatment, right? But first of all, as I have cleared, these two group of disorders will not be included, as well as the psychosexual disorders will not be part of this training program. Far other than that, all those disorders in the DSM will be hopefully discussed in this 1 month certified course. Then it comes to the treatment approaches, as we have discussed earlier, exploring the therapeutic intervention and psychosocial factors for an individual is very important to develop a personalized treatment plan. Always remember, when you are consulting a treatment-based psychotherapy for an individual, you have to keep it in mind that your case formulation and case conceptualization is very important to decide which kind of therapy or which kind of intervention is far more suitable for a particular person. Not every person is very susceptible for CBT in case of depression. Let me tell you that. Sometimes you have to work with the 35, 40-year-old patient via play therapy because they are not very much legit to understand the CBT. They wouldn't be very committed towards the CBT. So you have to understand the complexity of individuals' perception. You have to see the world from their eyes first, right? So you will be understanding the multidisciplinary approach when we will be talking about the individualized disorders, all the mental health disorders. So that will be implicating the evidence-based practices. Now we will summarize the whole lecture here. Today, we have talked about the key insight into the diagnosis and behavioral manifestations of the psychopathology. We discussed about the psychopharmacology today, the implication and role of psychopharmacology, and the importance of the professional in understanding the mental health challenges. We have discussed our ethical consideration and limitations as well. For today, it was all just now. In case of any question or query, you can contact me later. Thank you so much, everyone, for today. And keep in your mind, your class will be as scheduled as today for tomorrow. It will be 8 to 9 p.m. and hopefully it won't be very long like today. So be vigilant and be on time next time. Thank you so much. Take care of yourself and have a good day.